Have you ever noticed that everyone seems to throw around Medicare terms like Part A, Part B, Medigap, Medicare Advantage, and Part D as if we're all supposed to know exactly what they mean? Then one day you realize Medicare is right around the corner for you, and suddenly it feels like everyone else got the instruction manual except you. If that's where you are right now, take a deep breath. You're not behind. Nobody teaches this stuff in high school, and most of us don't start paying attention until Medicare is suddenly sitting on our doorstep. So let's start with the foundation. Today, I want to explain what Original Medicare is, what it covers, and why understanding this one piece first makes everything else easier. When people say Medicare, they're often talking about Original Medicare. Original Medicare is the federal health insurance program that most people become eligible for when they turn 65. Think of it as the foundation of the Medicare system. Before we talk about supplements, prescription drug plans, or Medicare Advantage, it helps to understand the foundation first. Because once you understand Original Medicare, all those other pieces start fitting together. Original Medicare has two main parts, Part A and Part B. I like to think of Part A as your hospital side. Part A generally helps cover things like inpatient hospital stays, skilled nursing facility care under certain conditions, hospice care, and some home health services. Then there's Part B. Part B is your medical side. This is the part that generally helps cover doctor visits, specialist appointments, preventive screenings, lab work, outpatient procedures, and certain medical equipment. A simple way to remember it is this. Part A is primarily hospital coverage. Part B is primarily medical coverage. You don't need to memorize every detail today. Just understanding those two categories puts you ahead of many people who are just starting their Medicare journey. Now, here's a question I hear all the time. If I have Original Medicare, does Medicare pay for everything? That's a great question. Original Medicare helps pay for covered healthcare services, but it's designed as a cost sharing system. In other words, Medicare pays a portion of covered costs, and you may still have deductibles, coinsurance, or other out of pocket expenses depending on the care you receive. And that's completely normal. In fact, understanding that Medicare is a foundation, not necessarily the entire house, helps explain why some people choose additional coverage later. We'll save that conversation for another video. One thing I always want people to understand is that Original Medicare gives you broad access to care. Many people appreciate the flexibility of being able to see providers who accept Medicare without worrying about network restrictions that may exist with other types of coverage. Again, every situation is different, but understanding the foundation helps you ask better questions when it's time to look at your options. This is where many people start hearing terms like Medicare Supplement insurance, also called Medigap, prescription drug coverage, also called Part D, and Medicare Advantage plans. Those are separate Medicare decisions. And honestly, they become much less confusing once you understand Original Medicare first. That's why I always encourage people to learn the foundation before comparing plans. If you're approaching Medicare age, don't feel like you need to learn everything at once. Start with the basics. Understand what Original Medicare is. Understand the difference between Part A and Part B. Then build from there. And if you'd like a written version of everything we covered today, along with additional examples and resources, I've linked the companion article below this video that can help you continue learning at your own pace. You'll find links below. Until next time, no call centers, no 1-800 numbers, just Robin Dall, Medicare broker, educator, and commission remote online notary, here to make 65 feel a lot less overwhelming. Before you go, watch this one next to go deeper into the alphabet soup of Medicare.